this scenario, we see a long-term resident of a skilled nursing facility being visited by his physician. The patient was recently hospitalized with complications from congestive heart failure, or CHF, and is now returned to the skilled nursing facility. He already has a PULST form indicating limited additional interventions, and his PULST form is transported with him. He doesn't want to go back to the hospital. He doesn't have any family, and since he has lived at the facility for a while, he is very close with some of the staff who take care of him.
Glenn,
Hey, Doc.
how are you?
Good, how are you?
Welcome back.
It's good to be here.
Yeah, wow. We got to stop meeting like this. Yeah, we missed you. It sounds like you had a rough go this time.
I didn't know I'd come back, tell you the truth.
Yeah, that's what I heard. I heard you had some pretty scary hallucinations and got delirious and so on.
That's what they tell me. I know I'm where I like being now. I like it here, and I really don't want to go back there.
You don't want to go back to the hospital?
Not really.
You've been there, what, half a dozen times in the last 8 or 9 months?
Yeah, 6 times.
Yeah.
6 times is enough.
So you're saying even if your condition worsens, you don't want to go back to the hospital?
Yeah, you know.
Okay, that's good that you brought that up, because I just happened to have our friend the PULST form here.
Papers back.
As you know, you can change your wishes when you feel like there's a need to do that, and it sounds like maybe you want to make a change in this form now. Last time, you said that if you had a cardiac arrest, for example, you wouldn't want aggressive or heroic measures like doing CPR, chest compressions, or putting a tube down to breathe for you.
If they can do it here, do it here.
It's sort of a whole nother level of care that you can get at the hospital or the intensive care unit. And if you don't get that, then you might die sooner.
I figure everyone dies in their own time. That's what I'm going to do here.
All right, so even though you might die sooner, you would rather just kind of live out your days here.
Pretty much.
So basically what we can do here is, we've got you on the oxygen, we'll check your vital signs and keep track of your weight, because of the congestive heart failure. We can do lab work. We give you antibiotics, of course. If you need some IV fluids, we can give you a little bit of fluid or IV antibiotics, things like that. We can give you breathing treatments, but we can't do the higher level stuff. You okay with that?
That's fine with me. That's the way I want it.
Okay. All right, well, in that case, what we'll do is we'll void this old form, and we're going to fill out a new one on you. We'll check the limited interventions box, and also the do not transfer to hospital for medical interventions. So you get that. Explain to me what that means.
Well, I've had enough ambulance rides, basically. I'm just tired of those things. I'm going to stay here.
So we won't ship you back to the hospital. Now, if you do change your mind at some point, if you get in rough shape and you say, maybe I actually do want to go to the hospital, we can change it.
So Mr. Bailey has returned from the acute care. He's been a resident with us for a long time. I understand you know him quite well. Unfortunately, he was admitted recently with an exacerbation of his congestive heart failure. And so he is very anxious to come back. And so we want to make sure that we have everything in order and updated care plans so that we're doing all the right things for him. He recently had a conversation with Dr. Steinberg and revisited his PULST form, which is essentially the same, but he updated one component of it. And while he remains a do not resuscitate, and he wants limited interventions, he does not now want to ever go back to the hospital. He really feels that he would like to be able to remain here. He feels this is his family, his home, and he feels very safe and comfortable here. And we had a discussion about the limits of what the facility could offer and the things that we could offer, and he was perfectly happy with the things that we could offer, including nebulized treatments for any kind of shortness of breath. And we wanted to make sure that all the staff knows that in the event that he gets into some sort of pulmonary problems, breathing problems, that we make sure that we have a plan A and a plan B for him, because he does not want to have the mask, the BiPAP mask, and he certainly doesn't want to be intubated. So I think we're all pretty current. You know him the best, and both of you have been working together with him, and we want to make sure that we're not only looking at the medical part of who this wonderful man is, but tell us a little bit about some of the things that might help make
Okay.
his life a little better here.
Of course, Glenn's been here for about 3 years,
Yeah,
Correct?
over 3 years.
and he knows the staff on the grounds. He knows us. He knows us well. He's been around us. We're like his family.
Yeah, he's really just tired of being in the hospital. He's been hospitalized multiple times in the last year, and he's pretty realistic about his disease process, and that the hospitalizations aren't actually benefiting him. And most of the things they're doing there, we can do here for him. He's a really interesting guy. He's a guitar player, and he was a homeless advocate for many, many years, and just a really neat person. And he does regard this as his home. It's he looks forward to coming back. Every time I see him come back from the hospital, he talks about how much this is like home for him. So.
Okay, good. And we've reassured him that in the event that we're unable to manage his comfort here on some level, that there's always the option of going back to the hospital, and he recognizes that. But the really big goal for him is to make sure that we have a good plan, solid plan for pain and symptom management, and that socially we all engage in being able to support him as best as we can.
The key points about Pulse that we just saw demonstrated are: the Pulse conversation can include an interdisciplinary team, particularly in the skilled nursing facility setting. Pulse can be changed at any time by a patient with capacity if the patient's medical condition, goals, or care setting change. Patients may choose not to be transferred to the hospital to receive medical interventions. Depending on the skilled nursing facility, some treatments such as IVs can be given at the SNF.